Hi, my name is Sarah Barker. I'm here with my friend and colleague Lexi. We're going to review a case conceptualization for our patient Simone Baker. So Simone is a 20-year-old female. She has two children, a 3-year-old son named Zaire and a 4-month-old daughter named Amber. Her boyfriend currently lives with them, is the father of her 4-month-old daughter, and her son Zaire's father is from a high school romance. She had Zaire when she was 16. Her current boyfriend is not a big support to her in the home. She stated that he currently works a lot of hours, so he's not home very often. Um, she referenced that she does not have many outside supports either. She's currently not employed. She stopped working when she was 4 months pregnant with Amber due to not being able to be on her feet for extended periods of time. She did state that she wants to return to work, but is waiting until Amber is at least 6 months old. Um, Simone appeared in her session tired and overwhelmed. She stated she was unable to breastfeed and was extremely frustrated by this. Currently, Amber is on formula. Um, she had previously been living with her mom and sister, who were helping support raise her children. Um, but she recently moved out into a one-bedroom apartment with her boyfriend and her two children. So far, what concerns are you seeing with the case of Simone?
So I'm seeing a few. I'm definitely concerned about the fact that she's feeling overwhelmed with her responsibilities with, having two young children. I am concerned with the potential of, maybe some postpartum depression. I know that there is a correlation between the desire to breastfeed and not being able to breastfeed and postpartum depression. And I think that at this point, in order to better understand what's going on with Simone, it would be good to have, a previous health history, look at some of her childhood experiences through an ACE survey, see what her social history is. And finally, I'm concerned that she doesn't seem to be getting a whole lot of help.
Mhm.
She's lacking in some resources. She's not working and she's at home alone in the apartment
Mhm.
without a whole lot of support. So I think that these are all things that warrant a little deeper dive.
Yeah, I definitely agree. I think it's important to mention that the health of Amber, um, she is in very good health, and she is seems to be doing well with getting the prenatal care that she needed. And currently, when she came in for her vaccine, she looked like she was doing very well. So I think it's important to just note how mom is feeling and focusing on how she could be affecting her kids and in the stressful environment that she's going in.
Absolutely. And we know that, with ACEs, prevention is best.
Mhm.
So I think that we're at a pivotal moment that we can kind of step in and offer some resources and, help in not having ACEs for Amber and Zaire.
Yes, definitely.
So we explained to Simone that it would be helpful to look at some of her past childhood experiences through an ACE survey, just to get an idea of what her upbringing was like. So to look at Simone's past history, she grew up in a household headed by a single mother. She was the youngest of three children, two being children that were half siblings and substantially older, 10 years older and 8 years older than her. Her father was an infrequent visitor in her life because he was incarcerated in and out of jail. And he was unable, due to that, to provide little financially. So he was kind of just periodically in her life. Her mother worked two jobs, but they frequently didn't have enough food to eat. So a lot of times, Simone and the other siblings would use the school lunch programs and things like that. However, having enough to eat was definitely an issue. Her mother was a strict disciplinarian and often used a belt or a strap to discipline Simone and the siblings. And Simone reported that she often had bruises on her thighs and her buttocks after that. Her mother also suffered with severe bouts of depression. On two occasions, the siblings were placed into foster care as the mother sought treatment in person hospitalization. However, with this, Simone did report that her sister was a protective factor for her. She often helped her with schoolwork, and she felt as though she was loved, especially by her siblings. When Simone was 5, her mother had a boyfriend named Ben who came to live with them. And Simone reported that the boyfriend would often be intoxicated, and that would result in some um, intimate person violence between the mom and Ben. On one particularly bad occasion, Ben did put a knife to the mother's throat. The mother was able to get away, but Simone did witness that. Outside of the home, Simone liked her classmates. She doesn't report feeling discriminated against. However, they did live in a violence prone neighborhood. They weren't able to go outside at night because of drug activities near the home, and several of her high school friends were robbed at gunpoint. She doesn't report being sexually assaulted or being coerced to have sex as a child. So then we get to her mother. So Simone's mother developed severe diabetes in her 30s, and that resulted in an amputee. And so her mother ended up needing assisted living. This is what prompted Simone to then have to move into that 1-bedroom apartment. Um, we also asked if Simone had any episodes, any prior history of depression. And she said that in 9th grade, she was feeling really, really down, saw a school counselor, and was also engaging in self-harm. Since Amber has been born, however, again, she's been feeling really, really sad. She's having trouble getting up in the morning and doing her motherly duties. She also lost 15 pounds and said that all she wants to do is sleep.
Hi, everyone. We are back continuing our conversation on the client Simone Baker. We ended off with discussing her history, her family history. We dove into a little bit of her current state where she's living and some of her background. From that conversation, we decided that an ACEs survey would be the best route to go at this point to examine how some of her past experiences and traumas have been affecting her. So from the Little Book of ACEs, we know that stressful and traumatic experiences that occur in a child's life really have an impact on them later on. Some of these events can include domestic violence, drug and alcohol abuse, family mental health, physical, emotional, sexual abuse, neglect, separation or divorce of parents, and incarceration of a family member. Understanding how ACEs directly harm a child is important to note when you're working with children, but also when you're working with adults. Looking into their previous experiences and understanding what their environment was like growing up is important to note as a counselor, no matter what age the individual is you're working with, because you don't know what they've worked through and what they've shared. So ACEs can really indirectly cause harm, even if the child's not aware of it, due to the effects of the environment that's around them, where they're living, what type of experiences they're having at school, if they're being bullied, witnessing domestic violence, any type of traumatic experience for the child can cause harm to them in an indirect way. Looking at Simone, we just wanted to dive into hers and kind of examine her score a little bit further. So just looking at the first few questions here, did a parent, step parent, or other adult in the household often or very often swear at you, insult you, put you down, or humiliate you? Simone does check yes for this. Lots of verbal abuse and bruising, physical abuse from her mother in her past. Did a parent, step parent, or other adult in the household often or very often push, grab, slap, or throw something at you? Again, yes, we do know that there was instances of physical abuse in her past from her mother. Did an adult or person at least 5 years older than you ever touch or fondle you or have touched their body in a sexual way or attempt an actual or actually have oral, anal, or vaginal intercourse with you. Simone did not report any sexual abuse, so we did put her down for no on that one. Did you often or very often feel that no one in your family loved you or thought you were very important or special? Um, we put no for this one. Simone said she always felt loved, especially by her siblings. We do know that she had a very close relationship with her sister, and she was very protective of her and really filled some of that motherly role for her. Did you often or very often feel that you didn't have enough to eat, had to wear dirty clothes, or had no one to protect you, or your parents were too drunk or high to take care of you or take you to the doctors if you needed it? We put yes for Simone for this. She did speak about not having enough to eat, even though her mother was working two jobs. She discussed just the lack of food that was in the house for her family. And then we also see some concerns with her biological father being incarcerated. There is a lack of support coming from that department, as well as her mom's new boyfriend, Ben, drinking a lot of alcohol around the children. That kind of puts her in a position that she would be exposed to more traumatic events from that behavior.
So next we have, were your parents ever separated or divorced? We do know that the biological father was not in the picture. He was incarcerated and given the mom's boyfriend separated. So that was a yes. Was your parent, step-parent, or another adult who was helping to raise you often or very often pushed, grabbed, slapped, or had something thrown at her or him, or sometimes often or very often kicked, bitten, hit with a fist, or hit with something hard? And then finally, or ever repeatedly hit over at least a few minutes or threatened with a gun or knife. So we do know that the mother's live-in boyfriend, Ben, was often violent when he would become intoxicated. So that was a yes, as well as also Simone witnessing Ben holding a knife to his mother's throat. So we see a lot of intimate partner violence with Ben and the mother. Did you live with anyone who was a problem drinker, alcoholic, or who used street drugs? So this was a yes, as the biological father had a severe substance abuse problem, as well as the boyfriend Ben being an alcoholic. Was a household member depressed or mentally ill, or did a household member attempt suicide? So again, we have a yes, as the mother struggled with frequent severe bouts of depression. We know that she had to be hospitalized on certain occasions, and the children also had to go into foster care at those points. Did a household member go to prison? Yes, we have again the biological father. Did you see or hear someone being beaten up, stabbed, or shot in real life multiple times? So this was a yes, as Simone frequently saw her mother being beaten up. And again, this was at the hands of the live-in boyfriend, Ben. Did you often, very often, or sometimes feel that you were treated badly or unfairly because of your race or ethnicity? This was marked as a no, because Simone stated that she did not feel discriminated against in her community. Did you feel unsafe in your neighborhood some, most, or all of the time? So this would be a yes, as Simone stated that it wasn't a very safe neighborhood to grow up in. Often people walking home from work or school would be robbed at gunpoint, and she did not feel very safe. Were you bullied by a peer or classmate all of the time or most of the time? No. Simone stated that she felt very at home at school. She had a lot of friends, and that was a good social resource for her. Were you ever in foster care? Yes, Simone was in foster care with her siblings, the times that the mother needed to be hospitalized for her severe depression. So looking over this, we have a very high ACE score. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So Simone actually has 11 ACEs. This is considered extremely high. Understanding and putting the score into perspective, a child with 4 or more ACEs, typically you're looking at a chronically traumatic situation. That was definitely the case with Simone, as she had, infrequent and unstable caregiving. there was a lot of issues with domestic violence and intimate partner violence with Ben and the father. And you see a lot of what Sarah briefed us on in terms of the different ways in which ACEs come about with different forms of abuse and neglect. So for somebody with this high of ACEs, you're looking at a lot of potential health risks and a lot of associated health conditions that definitely are something to look into. So with someone with a high amount of ACEs, you're going to have lower levels of parent and child attachment. Now that would be both for Simone with her caregivers, but also we now have to take that into consideration, considering that Simone herself now is a mother. And we know that these things can be passed through generations. Health risks associated with ACEs, you have obesity, depressed mood, suicide attempts, smoking, drug and alcoholism, an increase in risky sexual behaviors. And then with those risk factors, then also come a lot of associated health conditions, cardiovascular issues, COPD, pulmonary issues, and you can see the correlation between, the risk factor of smoking and how that might manifest into cardiovascular and pulmonary issues. You also see things like diabetes, cancer, strokes, hepatitis, jaundice, skeletal fractures. And what's interesting about this is considering some of these associated health conditions, we see a lot of this with Simone's mother.
Mhm.
So it almost makes you wonder, is, Simone's mother also somebody that experienced ACEs as well?
Mhm.
Um, is there anything that you would like to add considering the ACE survey before we move on?
Yeah, just touching off of what you had mentioned about how high her score is and the associated risks that come with that. We know from the Little Book of ACEs that it can multiply depending on how many ACE scores they have. So we know that 4 or more ACEs, they're 2.5 times more likely to increase acquiring an STD, 5 times more likely for an increased risk of using illegal drugs, 7 times more likely risk of alcohol addiction. And if they have 6 or more ACEs, they are 46 times more likely at risk for drug use, 35 times more likely for risk of suicide, and they are at risk for their lifespan being shortened by 20 years. So a lot of these factors that Simone has shared, a lot of the things that make her who she is, put her at risk for experiencing a lot of these. So providing positive tools for her, helping her work through this trauma, and stopping that intergenerational, transgenerational expansion of sharing these ACEs with her children is very important right now in her care and for the safety of her children as well.
All right, well, let's discuss some ways that we can help Simone and her children with this.
Sounds good.
All right, Sarah and I are back discussing the case of Simone. We have just gone over her ACE score, which is extremely high. So for that reason, we both feel that it's beneficial to also, with her presenting problems, her history of depression, both her own history and her familial history with her mother, as well as her risks for postpartum depression, we both feel that it would be helpful to refer Simone to some mental health services, as well as psychiatric services to get a combination of CBT, which we know is very beneficial when it comes to trauma-informed care, as well as ACEs, and childhood neglect and abuse, as well as psychiatric will more than likely put her on some SSRIs, as we know that the combination between therapy and SSRIs is the frontline approach to depression. As well, we also had Simone do a childhood resiliency survey, so we're going to take a look at that, just to see some of the positives in her life right now, as well as in the past. So to reflect on Simone's childhood resiliency survey, She often felt that she had someone in her family that stood by her in hard times, and that was her half sister. She had someone in her family to talk about difficult feelings. And again, she marked yes, that again was her sister. She felt supported by friends. She felt a sense of belonging in high school. So you're seeing that outside of the home, Simone actually does have some, well, also with her sister, but some protective factors with her friends and going to school. She often enjoyed community traditions that Simone checked no, and she often had at least two adults other than her parents who took an interest in her. Simone again checked no. So one of the things that we're seeing here is a lack of community resources, a lack of the prototypical caregiver and mentorship roles that you often see from adults in other community-oriented things. And for this reason, we feel that being able to foster some other community resources for Simone would be something that's very beneficial with her experience of ACEs, and also, again, not having that transgenerational passing down of the ACEs. Um, so,
We understand that the isolation too is a contributing factor to a lot of the mental health concerns that Simone is discussing. So isolation with depression is very common and can build off of those feelings. So providing a space for Simone to get back out into the community and make more connections is very important for her right now. Simone discusses her education. We know from the Little Book of Aces that a high ACE score not only puts you at risk for behavioral concerns, but also educational concerns. She did share that she dropped out of high school after having Zaire, so about 16, 17. She shared that she completed her GED last year before becoming pregnant with Amber. And now she is back to work and is getting some more engagement from people outside the home. Being in the one bedroom apartment with just the two children while her boyfriend is at work would be very isolating. So having an opportunity to be back out in the community, back out with adults, and back to work is giving her kind of a sense of purpose and meaning.
and it also, with that, being able to have some time where Simone has time for herself, where she's not just in this constant parenting role, will also make it so that she is a better, more effective parent. We also need to look at ways in order to reduce Simone's toxic stress. And any time outside of that, where she has a chance, she calls it a chance to be an adult, will be beneficial for her relating to her children. Some other ideas would, in terms of having other caregiver prototypes, could be something like Simone dropping her children after school at some sort of after school program, and then the children will have access to other caregivers and other mentors that can help take a lot of the burden off of Simone. Another way that that could be done is having, for example, dropping off her kids at a community barbershop where the kids sit and just engage in some of the roles in that, and thus, again, are being exposed to another, mentorship. Um, we also had some ideas for working with some of the attachment related issues that Simone has, both with her children and what she would have experienced not having a secure attachment growing up. And for that, we thought that PCIT, parent child interaction therapy, would be very beneficial, both in instilling a better and more positive relationship with her children and a secure attachment with them, as well as we know that this helps the adverse effects of trauma as well. So that would be done through child-directed interaction, use of pride skills, praise, reflection, imitation, behavior description and enjoyment, and also parent-directed interaction. So one of the issues that we talked about Simone having trouble with growing up was some very strict, harsh, bad discipline from her mother with the belt. And so due to that, learning some positive discipline skills with consistency, predictability, and follow through is not only going to help her children not act out as much, but it's also going to be a positive way that she's able to instill discipline without abuse, essentially.
Yeah, and I think with these tools and what Simone has recently shared in her most recent session with returning to work, She told us that she is part of a management training program that she's very excited about. She plans on attending community college to get her associate's degree. She actually stated she's enjoying being a parent again. So continuing to build off of the things that she's already worked really hard on to improve in her life and recognize the positives and the resources that Lexi just discussed to help her keep moving forward on that path. We feel that Simone has really set herself up to work through some of these ACEs herself, but also stop that generational trauma from reoccurring with her own children.
And help with not experiencing all of the physical health ramifications, mental, emotional health ramifications.
Yeah, definitely.
That those ACEs kind of set her up for.
Absolutely.
All right. Well, this was the case of Simone Baker, and we feel that she is well on her way.
Thank you.